Hey, everybody, it's Paul with American Health Revolution. I'm here with my co-founder, Karen McDonough. Hey, Karen, how are you?
Great, Paul. Good to see you.
Good to see you as well. And thank you for taking the time to be here as we welcome our special guest, Dr. Irene Mavrakakis. We know her as Dr. Mav, and we've had her on our podcast before, but today she's here to discuss something we think is very, very important and that she's put a tremendous amount of time into. And it is a review and analysis of the COVID-19 injections, harms, damages, a non-exhaustive conclusion. You've had, Irene, you've had many highly accredited co-authors, and I'm going to let you, if you don't mind, because I saw over 150 citations in here. You obviously did your homework, but I think it's really important to establish at the outset the integrity of your approach and how you went about doing this to make it an unimpeachable conclusion that you've arrived at, right? So would you kindly just say hello and discuss that for a moment? I'd appreciate that.
Well, first of all, thank you so much for having me on. And I do think it's important for people to understand how we got to this 10-page, 153 reference paper, which is an analysis and literature review of COVID vaccine biologic harms. And the lead author, Dr. Andrew Zhivets, really had this idea to make a paper that summarized all the harms with all the experts who have been writing about the harms, and to make it something that laypersons and administrative officials and people in public health could use as a reference point. And so peer review process for them is double blinded. So what that means is we took all our names off of it, and the peer reviewers did not know who wrote the paper. And we also were not told who the peer reviewers are. I don't know who the peer reviewers are to this day. And
I think that's important to make a point of.
Yeah, of course. So what that's called, right, is double-blinded, triple peer-reviewed, right? And then we had to resubmit for final approval by the editors. And then that was finally approved with a couple of edits and then some grammatical, and then we went through it all over again. And then myself and one of the editors went through all the references again just to double check that they were in order and all of these things. And I probably won't do another paper for a little bit. And it's a lot. I work full time as a physician plus my other projects, And
let me interject. That's important. That's very important, because that makes this paper so credible, right? With all of those 100, did you say 153 references?
Yeah.
On a 10-page paper, right? Or 8-page.
Yeah. Because the other last few pages out of the 10 in the publication is references. But the most overwhelming majority of them are all peer-reviewed papers, all on their own in the references.
And, there's so many people that are going to be able to really appreciate this. I read it myself. I am a lay person, and I found it to be very clear and concise, and I could understand it very well. There's one little section that was a little bit out of my league, but I think the way it's laid out, starting with, the origins of SARS-CoV-2 and modified mRNA vaccines and biologics. Let's talk about that. Let's talk about that. Yeah.
So, the important part of the whole thing is the goal of this project was us to tell the truth backed up by facts and references. And the reason why we wanted to do this is we wanted to help people see what really happened, and for us to really move past this, and to also help those in administration that are trying to speak about the truth. And everybody remembers, like, it came from a wet bat market and all this, hootenanny, really. But the thing is that, it is born of gain-of-function research. And if you think about the fact that if SARS-CoV-2 or this whole coronavirus issue is a bioweapon, right? Because gain of function creates bioweapons, right?
That's
Then
my understanding, that they are training a virus to be more viral, more deadly, right?
of course,
Right.
of course. I mean,
And-
we shouldn't be doing this at all.
And I think a lot of people, ladies, are going to struggle to get their arms around that concept. I think a lot of people would rather stay in denial and just say, no, they wouldn't do that to us. They wouldn't create a biological weapon which could then easily find its way into the population. But we seem to think that's what happened.
Well, human hubris, right? I mean, we
Hubris.
get into trouble a lot, right? So just because you can't doesn't mean you should. But and the other point that's really important for people to understand is this is a bioweapon. And the COVID mRNA vaccine and biologics, which is synthetic messenger RNA that's injected into you, that goes into your ribosomes and makes you a spike protein producing factory, is a bioweapon because it's making you create the worst part of the original bioweapon, which is the spike component. So the shots are bioweapons as well.
Right.
Because they're making you make the bioweapon spike.
And let me ask you a question, Dr. Irene. Is the explanation behind this gain of function research, what I've heard in the past is that we have to do this because we know our enemies are doing it and we need to stay one step ahead? Is that pretty much kind of the way that it has been, I guess, explained to the public in general?
I think that for the most part is the narrative, right? So let's think about what that means. And so the idea, because they've been working on mRNA vaccines and biologics for 8 to 10 years. And in September 2019, the National Institute of Health gave a small vaccine company called Grefex $19 million to work on mRNA coronavirus vaccines and biologics, right? So this is not new. So this is supposed to be the countermeasure, right? So what really happened is we had a bioweapon released, and we got this, guys. The countermeasure is this mRNA nightmare that makes you a spike protein producing factory. And they had so much hubris that they didn't understand that the human body will always fight anything that's injected into it. Just like people who get too many bee stings become anaphylactic. Meaning that you can never not have a risk when you invade the sanctity of the human body. And so the hubris was that there was some surprise that there was autoimmune IgG, there was allergy IgE, there was consequence of spike itself on the cardiovascular system, and all of the things that we talk about. And for some reason, all of these public health people and doctors forgot basic science and biochemistry, because Dr. Z and I talk about it. They're really, the concepts that we are explaining to people is basic medical science. This is not new stuff. The vaccinating during a pandemic is never been done before. And we know respiratory virus vaccinations are a problem because they mutate so much. So being surprised that we were mutating is also absurd. Not checking for natural immunity, also absurd. I cannot understand the intentions of those that were involved in this, but really this was to say, so this is our bioweapon research and these are our COVID countermeasure, right? Because it's called the COVID Countermeasure Injury Program, right? This is supposed to be the antidote.
That's
the
news
antidote,
to me.
The injury program is established as the COVID Countermeasure Injury Program. It's been up since the beginning. You have to declare your injury within a year. It's at hrsa.gov or whatever that is. And, that's where you claim to have your injury because it's outside of VAERS before it was on the vaccine schedule, because VAERS only applies to things that are on the childhood vaccine schedule. This is the PrEP Act component of all of this, right? So it doesn't work.
Right.
But they shouldn't have been surprised that it doesn't work. And all of these harms, which were seen in the preclinical trials before they were launched upon the general population anyway, but because vaccine makers have product liability protection through the 1986 law, HR 5546, for the childhood vaccine schedule, right? And we have VAERS, and $7 billion has been paid out for the vaccine injuries that you guys don't even know about, and 1 to 10% are not even reported. And the PrEP Act that was passed, I think, in 2005, which was implemented for COVID, that established the COVID countermeasuring injury program and gives liability protection for not only the people that make it, but the people administrated, set the stage for what? Lack of safety, because there's no motivation, because there's no consequence to harm. Right. These vaccine companies would have never let these have been launched upon the general population if they didn't have product liability protection, because they knew.
Right. Right.
And it basically green-lighted the EUA process, right? They don't have to go through the rigors of like the FDA approval, right? Because they have emergency use authorization.
Right.
Right. Which you cannot get if you have medications to treat, which is the intention of the demonization of hydroxychloroquine and zinc and ivermectin.
Yeah, that's right.
And you talk about that in your paper too.
Yes, that's in one of the conclusions at the end, the harms and the lack of promotion of vitamin D. So the COVID debacle was both unscientific and unconstitutional, but it shows the failure when you have central planners in public health, just like all failed central planners, right? They are so much in the ideological bubble. It's kind of like the warmongers and their warmongering ideological bubble. We have like the Faucis and all these people that are kind of a bunch of central planning Lysenkos who, fail to see outside of their own bubble.
No, I think it's a really important point. I don't think people really understand the significance of the emergency use authorization and what that did. That it did multiple things. It gave liability protection, right? And it also it could only happen if there were no other available treatments, which again, we saw several doctors trying to speak out about hydroxychloroquine and ivermectin, and there were plenty of functional doctors that I follow that were having success with high-dose vitamin D, IV vitamin C, anti-inflammatory types of treatments, right? Curcumin, there's many. But the other thing that I want to point out is when you have an EUA, mandates are actually illegal. You cannot mandate a product under an EUA, but yet it happened, right?
Well, yeah, and
overreach. Yeah,
more overreach. Mm-hmm.
Right, and right now they're talking about like reestablishing religious exemptions and all this kind of stuff. But really, in these United States of America, we really should just have the ability to say no. We shouldn't have to need to have an exemption of any sort for any type of medical procedure. Why? Well, because we have these unalienable rights to bodily autonomy, and our government exists to protect these civil liberties, not to destroy them, which is what happened during COVID. They became the destroyer of the civil liberties that they are tasked to protect, and the people that are complicit in it are really, unfortunately, we the people, because we complied.
Right. Let me ask you about this DMED, the Defense Medical Epidemiology Database. So some of the data came from that database. Tell me about that. Is that the military health database?
Yeah. So this is primary database information from someone who he cites himself in the article. You'll look at the citations. Because he had access, had a right to have access. And so this data is his primary observation and acquisition of the data that shows these huge spikes in morbidity in the military when they initiated the COVID vaccination program, which of course they had a lot of infringements upon the civil liberties of the military members. And we all know what happened with that. And so, yeah, it's quite amazing that we were able to get him to write up his data, and the citation is himself, really.
Right, but some of the findings from this data are quite shocking. I just want to name a few here. So it says in 2023, updated DMED data from 2021 confirmed elevated diagnoses, including hypertensive disease by 22.9%, ovarian dysfunction 34.9%, pulmonary embolism 43.6% increase, and Guillain-Barré syndrome 14.9%, esophageal cancer 12.5%, breast cancer 7%, and unspecified myocarditis 151.4%. That's the biggest number.
Yes, and this is people that are in the military who are theoretically
Very
ready to fight wars, right? These
Very
are not
healthy
sick people. They had to come in healthy, relatively healthy, right? Right, because they couldn't have flat feet. I don't know. They don't do that anymore.
Right.
But the point is that they're relatively healthy people. And yeah, I mean, all the data in this paper is heavily referenced and cited. And go look at some of the other data. The OBGYN data will make you cry. But we could talk about how all vaccines are pregnancy category C, although they don't use that nomenclature. They not safety tested. And, when I was pregnant, I wasn't allowed to eat too much tuna. So the idea that you would inject a pregnant woman with an experimental medicine, not a weapon, it's not a medicine, it's a bioweapon, and be surprised. 9 million children got this vaccine. What percentage of those guys are going to have myocarditis and heart failure?
Let's jump over to the reproductive and pregnancy-related risks. And it says Pfizer's post-market surveillance report completed in February 2021 documented 42,086 adverse events, including 1,223 deaths within 10 weeks of the vaccine rollout. Pregnancy-related outcomes showed an 81% miscarriage rate. That's shocking.
Well, and Dr. Z will talk about this because originally the way the data was represented, and it talks about this in the paper, is they were including third trimester, which is not a miscarriage. So the data was muddied, and then we reanalyzed it. Thorpe did. And so, yeah, it's profoundly significant. And the paper goes into that issue.
Yes.
This was talked about in the Ron Johnson hearing a few months back in May, this very issue about the trimesters. And that's purposeful manipulation.
Oh, it's fraud.
That is criminal. That is criminal.
Yes.
And see, a lot of people are listening to this, and maybe I'm going to say, what we're talking about is not a left or right issue. It doesn't matter what side of a political aisle you're on to say that, and we're not doing this to play gotcha. We're not doing this out of any vindictiveness. We're doing this because we care about the health and well-being of our children and our future. And we know for a fact that the United States has somewhere between 4 and 4.5% of the world's population, but we had 19% of the world's COVID deaths. Okay, so when we talk about this, we need to, as a nation, get to the bottom of it and recognize not just what was out of our control, but what was within our control that we failed to address. And I think, Irene, that a lot of people in this country are afraid. They're afraid to take on the truth. They want to trust their institutions. There's a pandemic. Oh my goodness, what am I going, what do? I want to trust these white jackets and they're going to take care of me. And if they tell me I need to take a shot and a booster, I'm going to do it because they're going to save me. This is what's going to save me, right? And I think as I look back on this, because I was among those who believed in it not too long ago, I look back and I recognize with somewhat of an open mind that, there were some other things going on here. I was hoodwinked. I was gaslit into believing something, and I've forgiven myself. Okay. But what we're talking about here is, we need accountability, and we need to get this right. And we need to restore trust in these institutions so that the patient's well-being comes first, just
Yes.
on a high level. Yeah.
No,
So-
of course, but let me tell you something. You were not given informed consent. And informed consent necessitates full disclosure and full disclosure of the risks and benefits. And the
and to
risks
this day,
were
they don't.
No, but your doctor and pharmacy and drive-through Burger King pharmacy people did not provide you informed consent because it was available, right? Because they were cowards and they were lazy. And then the ability to have informed consent necessitates your free ability to decline. And that ability to decline cannot be tied to what? Life, liberty, property, and the pursuit of happiness, okay? So, and I'm telling you, a lot of doctors knew something was wrong, right? But fear is the means by which we have totalitarianism. And that's the problem with COVID mania tyranny. You know what? I was vaccine injured in 2012 before it was popular to be vaccine injured or not popular. I mean, we have tons of vaccine injured, but it wasn't I was sick for 8 years going to Hopkins every 2 weeks. I don't need to do this. But I have to.
Right. It becomes a personal responsibility, I think, that you feel when you know what you know. And so I really am grateful for your efforts, Dr. Irene, and your commitment to doing this type of work, right? Because it's exhausting, it's hard, but you did a meticulous job. I want to ask you, there's one section on hypersensitivity and cytokine storms. Can you explain what that is real quickly?
So this is probably my favorite topic because it's based on a paper that it took me 10 years to write, and it's based on my own vaccine injury because my vaccine injury was on the allergy side. So I was in recurrent anaphylaxis as a consequence of my vaccine injury because we all have different tendency. The other vaccine injuries are autoimmune, hyperimmune, and then there's also immune exhaustion, which Dr. Villa talks about in her work that's going to be published soon. And so think about it. A couple of very important points. First of all, there's a Department of Defense study that shows that flu vaccine increases coronavirus susceptibility by 36%. So they were recommending flu vaccines when that was going to skew us towards coronavirus vaccination. But there's been many preliminary studies. One study is called Flu Vaccine Causes Dengue-like Illness. It's cited in the paper. And they found, this is before COVID, they found that in flu vaccinated individuals, they were inadvertently making IgE to the flu viral antigen. Why? Because repetitive sensitization or repetitive injections will sometimes make some people allergic to it. Mm-hmm. Why? Because that's just humans' way of fighting things. The same idea that I talked about with bee stings. Some people, after a few bee stings, will become anaphylactic to it, right? So anaphylaxis is our way of fighting something from repetitive sensitization. So why is this important? Because IgE can be non-specific. For example, I'm allergic to latex. Latex crosses with kiwi, avocado, walnut, and banana because it's genetically similar. Coronavirus and flu are genetically similar. So my hypothesis, this is not proven, this is one of my hypotheses that I'm working on, and this is not part of this paper, is that in the beginning of the pandemic, the people that were having the highest level of cytokine storm were military, nursing home, and healthcare workers. Well, what do those three populations have in common? They are heavily flu vaccinated because of quality measurement payment bonus systems and hospital systems that require these populations to have yearly flu vaccines, which actually I call for the complete recall of flu vaccines and coronavirus vaccines because respiratory virus vaccination has never been proved to decrease overall morbidity and mortality in the population. If you look back at when we started doing this, which was brought to you by a prior pandemic 10, 20 years ago. And so what is my point? My point is that the military, nursing home, and healthcare workers were heavily flu vaccinated. And a component of those people probably already had IgE to flu viral antigen. And there's a component of those people, my hypothesis is that they probably had their IgE cross-react with coronavirus. So their cytokine storm most likely had a huge histamine and IgE component. Now, I haven't proven that point, but there's tons of studies cited in this paper and my IgE paper published in June that shows that the researchers who were treating vaccinated coronavirus patients saw histamine, IgE, and cytokine storm that had an allergy component, meaning that there's multiple references in this paper and my original paper that show that in vaccinated coronavirus patients, they were having an allergy component of the cytokine storm.
Mm-hmm.
Does that make sense?
It does to me. And I want to ask you something. Are you familiar with what happened in the Lombardy region of Italy at the beginning of COVID? I think we're talking maybe about a similar theory here, right?
Yes, but listen, I analyzed that whole case. You ready? I had my Sicilian friend from New York City that I grew up with read the newspaper articles about the deaths in Lombardy. So Lombardy was this town in Italy. No one ever wants to talk to me about this. It's wild. And they had this, almost the whole town died, right? So I asked her to go back and look at what was going on in the newspapers and whatever. Before coronavirus, they had a large vaccine program for all the other vaccines. So they were really just, and you're not supposed to like vaccinate when people are sick. So there was mass vaccination programs in that town. So they were all recently vaccinated for a whole bunch of other stuff. So they probably had a lot of IgE and a lot of cytokine storm going on. And the other really important point of all of that, when you want to talk about data that's muddied, they would say that a patient is not considered vaccinated for COVID until they're 2 weeks post-vaccination. In that first 2 weeks, you're most likely to have the most severe adverse reactions, including this IgE component. And so
they were not attributing that to COVID, to the vaccine.
No, they were unvaccinated. That data is muddied by all the vaccine reactions that were most likely the most highest incidence, right? Because the sooner you have it, the most likely it's bad. And most likely they all had a component of that autoimmune, post-vaccination myocarditis, and it's not just the young people that have post-vaccination myocarditis. And that's not a new entity. That has been seen in the flu vaccine and other vaccines for decades. And there's treatment for it. And that's the other crime against humanity, is that there's IVIGG for post-vaccination myocarditis. There's also an allergy myocarditis and a heart condition called Kunis syndrome that I talk about in my paper. And the crime against humanity number 3056 or whatever we're up to is delay in diagnosis and failure to recognize that a medical procedure had risk benefits. And all those doctors violated their oath of ethics because they didn't even bother to consider that something stuck into a human being could have an adverse reaction. Sorry, I'm getting a little excited.
Oh, I love your passion. It's really nice. And it just shows how much you care.
Dr. Irene, when you were compiling this analysis, which you obviously put a lot of time into, did anything surprise you? Did you learn anything new from this? Was it just a magnitude issue or a severity issue? Or did you learn anything from it?
I learned so much. You can make me cry. About the authors,
which tells me that you're not like, that's good, because you're not starting from the conclusion and backfilling. You're actually going about the research.
No, prove me wrong. I live in that world. Prove me wrong, but I'm going to find out. And a couple of really interesting, the lead author is really brilliant. And Brett and Heather were talking about this on their podcast, the substitution.
Brett Weinstein and Heather Heying.
Yeah. The substitutions that create a scenario by which our ribosomes can make the degree of random unknown proteins, which that's what these things do, right? It goes into your ribosomes and it's how you make proteins, and it's how the body functions by making proteins and things like that. But the amazing amount of mistakes that injecting synthetic messenger RNA into the human body as an experimental procedure, and the hubris that we would mess with the genome of the human body. And there's no way that they knew that this was safe. So either they were ignorant or they were criminally negligent, and that's for them and God to decide.
Right.
Because we're not talking about anything so brilliant. We're talking about basic science. There is nothing in this paper that is actually unexpected
Right.
based on what they did.
Right.
We know that there's historical precedent for this, right? If you look back in what happened in England in the 1800s, and we even trace back to the early medical establishment in this country with the Flexner Report and the Rockefellers and the Carnegies, and how we could actually connect the dots going back well over 100 years to this sort of medical industrial complex, I call it, one of the four MICs: media, monetary, military, and medical, all industrial complexes, and they often work together. Right now, it seems like this narrative that comes from the medical establishment is under attack a little bit from people who are standing up to them, and now they're pushing back with all that they have, with every resource, to try to keep this stranglehold on people's health for their profit, for their agenda. And it sure seems to me that more and more people are waking up to say, you know what, this has nothing to do with what side I'm on. I said this before, but I recognize that something's not right here. We have a chronic disease crisis in this country where something like 195 million people are experiencing some chronic disease or some chronic condition. And we're the sickest nation in the industrialized world. We spend twice as much money per capita as any other nation on the planet for healthcare. And this is what it's done for us, Irene, right? So we need to start asking these questions. The people need to push back. And like you said, people have been complicit. It's not an indictment against them personally, but it's a wake-up call to say, hey, we the people must act. We must stop fighting each other and start fighting for what's right. And what's right is our children's health.
Right.
Well, yeah. And the answer really is just more freedom. So we're currently functioning as a captured oligarchy and not a constitutional republic. And the people that are in power are captured by the industrial complex, including the pharmaceutical industrial complex. But almost a majority of it all goes away when we fix our constitutional republic. And, there is no product in these United States of America that has product liability protection that the vaccine makers have. So you just have to be responsible for your product. And unfortunately, if you're not responsible for your product, that's what happens. We get unsafe, ineffective product that's launched upon the population by failing central planners. And so the answer is always more freedom, but it has to be true free market competitive forces in the health sector and a removal of all the regulatory capture. And if you look under the hood of it all, it's all about corruption. Right? This wasn't really a true free market in the health sector. And so, you can have your vaccine, but, don't tell me to take it, because I'm an American citizen and I also have God-given and inalienable rights.
Right. Right. Let's talk about the psychosocial and ethical considerations paragraph. If it's okay, I'm gonna read the first few sentences. Because I think they're very well written. COVID-19 vaccine mandates have caused significant biopsychosocial harm, including ethical violations, social fragmentation, psychological distress, economic devastation, and eroded public health trust while failing to deliver promised benefits. These policies disrupted individual well-being, societal cohesion, and institutional credibility, leaving lasting scars.
Yeah, so that is Aaron Chiardi, of course. He's a physician. He's, the one that sued the government with Dr. Jay Bhattacharya for infringement of his free speech rights. He was just so wonderful, so responsive, was traveling, sent it to us, and he took time out of his day to give us, if you understand We asked these guys who've written so many papers for 3 to 5 paragraphs of the highlights of, and we wouldn't take more, and they complained a little bit, right? That's hard, right? That's a very hard ask. And then for Dr. Z to take that and then collaborate into it. But yeah, there's the cardiovascular effects. Everybody talks about the myocarditis, but I want people to remember that it isn't just the young people that get the myocarditis from the vaccines. The myocarditis happens to everybody. But in the older population, it's muddied in the waters of the heart disease they already have, right? So we just notice it in the kids, and we can kind of peel it out and show better in the younger people that are dropping dead playing soccer, unfortunately, right?
Right. Right.
But can we talk about cancer?
Yeah, the effect of cancer.
I don't want to talk about it because it's not my favorite topic, but I think we should talk about it in terms of some things you discovered.
So cancer came from Paul Marik. So maybe Karen, you want to read a little bit from the cancer highlights. That's a much more difficult item to prove, right? Because it's hard.
Sure. And I think that I've heard the term turbo cancer being discussed. I think that's probably the same as an aggressive cancer, right? Is that right? Since 2021, following widespread COVID-19 vaccination, oncologists and peer-reviewed case reports have noted a surge in aggressive cancers occurring post-vaccination. These cancers are characterized by rapid onset, late-stage presentation, occurrence in younger patients, and relapses in individuals previously in remission. Epidemiological data from the US, UK, and Japan indicate increased cancer incidence, particularly in those aged 75 and older, with a rising rate of excess deaths. The very first step in scientific inquiry is observation, such as anecdotal observations by oncologist Kashyap Patel, who noted an increase in rare cancers like cholangiocarcinoma. I think that's the gallbladder, right?
Cholangiocarcinoma. It's part of the gallbladder system.
Okay. Thank you. And younger patients, and rapid progression in cancers such as breast and renal cell carcinoma since the COVID-19 pandemic began.
Yes. And they have biological mechanisms that, they're working out.
Wow.
The cancer is and this may be a little off topic, but cancer is a $200 billion plus business per year in this country. The size of the cancer treatment market is projected to double over the next 10 years. Cancer is a growth business. It's becoming a household word when we should be looking to eradicate it. It again just is reminiscent of the hubris in this whole scheme that is exchanging our physical, mental, emotional, and spiritual health, Irene, for the profit spigots of these companies and these agencies. And it was Upton Sinclair who said, it is very difficult to get a man to understand something when his salary depends on his not understanding it. We now know that the healthcare sector is the largest employer in the nation, right? And we actually, should we be considering that a good thing? I say no. We should be looking to reduce the size of the healthcare sector because we should be looking to improve the health of Americans.
Right, and reduce that need for attention, right?
Yes. And but we're increasingly being treated like lab rats. And I think the COVID experience, the vaccine experience, was in many ways a culmination of that abuse. That's how it feels to me today. What do you think?
Yeah, I think you make a good point. And I still believe, I think this might make you fall off your chair. I still believe the overwhelming majority of doctors
are good.
And I have
are good. I agree.
Colleagues, I hang out in ortho and neurosurgery world mostly. And so, they do great work. I think that they didn't do the due diligence, especially the ones involved in the treatment of COVID. But let me give you an example. It's not a cancer example. It's the best example of the horror that I have been trying to get out there for the last 3 years. I've probably known about this 2 or 3 years. So over 9 million children have gotten the COVID vaccine and biologic last time I checked. Okay. We'll just take that as, let's go with 9 million. Okay. These are babies and children. We know statistically, if we look at McKellar's data, that a certain percentage of people who get the COVID mRNA biologic will get myocarditis. Okay? Myocarditis is inflammation of the heart. A certain percentage of myocarditis patients will have enough injury to develop congestive heart failure. That means that your heart's not pumping enough to the extent by you get fluid backing up in your lungs. And congestive heart failure has a 20% 5-year survival. Okay? I just want to sit with that. So a certain percentage of 9 million babies are going to get myocarditis and congestive heart failure. Congestive heart failure presents as shortness of breath, for which they're probably going to think that they have, I don't know, respiratory syncytial virus or some other respiratory virus, because no one's going to be thinking, or I hope they think, maybe they should listen to me, that this baby who had 3 COVID shots might have, or 2 or 3, I don't know what happened, how many they got, might have congestive heart failure. Okay, now we'll sit with that for a minute. You ready? In 2017, I have the press release. We can pull it up. This is true. You can double check it. Moderna launched the development of a messenger RNA biologic called relaxin. 2017. It's in phase 1. I know, because I'm obsessed with this because it wakes me up in the middle of the night for the last 2 years or so. Relaxin has the indication for the treatment of heart failure. I'm just saying. That's what it's indicated for. 2017. Okay? Mm-hmm. It's in phase 1 clinical trials. There's a whole bunch down the pipe. Okay? So whatever potential side effects relaxin might have, because we know messenger RNA is going to have side effects, because whenever you inject the human body with something that is outside of what we are normally used to, we're going to have reaction, IgE, IgG, the consequence of it, right? So there is no such thing as invading the human body and not having consequence. Look what happens with bee stings, right? Mm-hmm. Just an example. If your baby is dying of heart failure, and your doctor comes to you, regardless of whether or not you actually know at that moment in time that the reason why your baby is dying of heart failure is because it's a consequence of the Moderna mRNA or the Pfizer mRNA COVID vaccine and biologic, that is a bioweapon that no human should ever have gotten. Doesn't matter. Are you going to accept the relaxin mRNA to save their life? Are you? I don't know. I think many would. I'm not even sure that I would fault them for it, because I'm a mother of 2 adult children. Okay? Right. So now we're going to have a certain percentage of children that are going to want relaxin messenger RNA. And then there's going to be inadvertent consequences and side effects of the injection of Moderna messenger relaxin mRNA.
Right.
And I promise you, there's going to be something for that.
Right.
And at some point, we're going to have human population component that is synthetic messenger RNA dependent. That's what I see, and that's a problem.
Wow.
Difficult to get my arms around that one.
So the problems are just going to be perpetuating the need, right, for more.
You have 9 million babies who have already gotten it. We know statistically from McCullough and others that a certain percentage of them will get myocarditis.
There's many doctors in the scientific community who they talk about mRNA in a very positive way, almost like with this reverence of some kind. Um, yeah, I'm trying to understand that. What are they missing?
Everything. Basic science. That's what they're missing. First, do no harm. Hubris,
Right.
Ignorance,
Yeah.
greed, money, power. We are supposed to first do no harm.
Right.
Yeah.
I also think a lot of, from what I observe, a lot of doctors are just very busy running their practices, and they're sort of, I don't think they have time to really, go down rabbit holes and research and question things. They're very dependent on their professional organizations and public health, directives, which fortunately, I think we've got public health going in the right direction now, hopefully, right?
Well,
but we've got still a problem with these professional organizations that dictate a lot of the policies that these doctors follow. Would you agree with that?
Well, that is a multifactorial problem. There's a couple of problems. A big part of the problem is insurance, mismanaged care, insurance controls, quality measurement payment system, which I've proposed needs to be removed, which ties vaccine percentages and other medications like your diabetes and all these things with quality measurements that give bonus payments. And the idea was to improve quality, but what it did is tied everything to pharma and vaccines. So that whole thing needs to get removed. And it started with Medicare, but then all the insurances follow. The second thing is that a lot of physicians are employed. And that's a really bad situation. Everybody needs to realize that employed physicians are a big problem. I'm employed, but I'm in a private practice that has, even though I have staff privileges, I'm removed from the hospital employment. So there's a big push of mismanaged care through that and the employment of physicians. And so a lot of people complied, a lot of physicians complied. I'm not excusing their behavior because of fear, and also groupthink and pack behavior. And oftentimes the people that go towards powerful positions, especially central planners, tend to not necessarily be the most empathic and best of us. I'll just put it that way. And so the other component of that is debt, burdensome debt of medical school and things like that. And I mean, I get what you're saying, and I'm just one human doing her missions because God gave me certain talents. But it's a combination of that and a combination of, they work so hard to be a doctor and they really just want to do their patients and they don't want to be bothered with all this, stuff. And I still believe, even though I'm really upset with a lot of them because I think a lot of them knew the truth and they were cowards, like profound cowards, that in their day-to-day life, they really became doctors to help patients. And so the answer to the questions is there's so many problems in medicine, but it's really about governmental interference and quality measurement payments and interfering with the doctor-patient relationship. EMR is controversial, but oftentimes most of the stuff in the EMR wasn't done or is not right because we're so busy charting that sometimes you can't even pay attention to what you're doing with the patient. But
so when you say EMR, do you mean the emergency?
Electronic health record nightmare.
Okay.
Because originally it became health records were just for you to write notes so you remember what you would do the next time you saw the patient. But now health records are tied to payments and documenting. And let me tell you, I spent a lot of times charting. And I have good staff that help me and do a lot of the scribing and things like that. And so really, medicine needs to go back to the doctor-patient relationship. We need, again, it's the capture, the governmental interference, the severing the doctor-patient relationship, the burdensome debt from undergrad and med school, and a lot of them forgot who they are. And it's just like any people in this world. It's really hard for me because I really can't believe that COVID mania tyranny happened. And I was speaking out early. And I think that's why I do all of this, because boy, let me tell you, this is a lot of grief. All of this.
It is.
It's a lot of grief. I don't have to do this. I have a great job in my primary specialty. I have family. I have friends. But we have to do this because I guess Isaiah says so. There's a gentleman called Matt Toon that I met, believe it or not, planning Rescue the Republic, because I do other stuff like anti-war stuff and things like that, and how we met as a riot. But
I just want to tell you, I worked with Matt on the Defeat the Mandates rally. So.
Oh yeah, and we know this. We've had this conversation, right? And I'm more on the LP side of all of this, but. And I didn't help plan Rescue the Republic. I was working on some other stuff with Angela, but he's just like, I brought him into this project just because he's Matt, and we weren't really sure what role he was going to play, other than he really helps with this whole movement. So I wanted to bring him into the project. And so we acknowledged Matt in the paper before the authors. It just is a little, right before the authors at the end, it's a little acknowledgement of Matt Toon. It's wonderful. But, we asked him to give it to Brett. It only came out last week. And he got it to Brett and Heather. And they had it on their podcast discussing the paper like that night. And that's Matt Toon. Because it's, they get so much stuff, and I have connections to them through Angela and other people. But Matt Toon is the guy that got the paper to Brett so Brett can talk about it on their podcast. That's why Matt Toon is just so important in the movement. So, kudos to him. And we can talk about the authors if you want to do so. It's Dr. Andrew Zivdak. He has a last name like mine. It's terrible. And myself, Peter McCullough, Nicholas Holcher, Aaron Chiarity, Paul Merrick, James Thorpe, Dr. Villa, Charles Rixey, Edward Macy, Lieutenant Edward Macy, and Abraxas Hudson, who has been with me since the beginning. He's the head of the Delaware Medical Freedom Alliance, and you guys all know him. And thank you guys. I probably messed up people's last name. I'm so sorry. And maybe if you want, we could read violations and conclusions. It's up to you. The violations kind of summarizes the whole root of the matter and the issue at hand. All right. So the evidence presented in this paper reveals a multifaceted crisis driven by the deliberate engineering of SARS-CoV-2 through gain-of-function research and the catastrophic health impacts of modified messenger RNA, biologics, and vaccines, which unleashed systemic toxicity across multiple organ systems. Vaccinating during an active pandemic without accession natural immunity, which is 27 times more protective than vaccine-induced immunity, risks dangerous immunological responses. Promoting influenza vaccines increase coronavirus susceptibility via respiratory virus interference. Basic health measures, such as ensuring vitamin D levels above 50 nanograms per milliliter to prevent disease, were ignored. Safe off-label treatments like ivermectin, hydroxychloroquine, and zinc with decades of established safety were suppressed. Coercion, suppression of vaccine limitations, lack of safety, efficacy, and transmission preventable, which we all know to be true right now, and violations of informed consent contravene the Nuremberg Code, Helsinki Declaration, U.S. constitutional protections of 1st, 10th, 14th Amendments, liability protections, Childhood Vaccine Injury Act, PrEP Act, and legislative failures, BioShield Act, Bayh-Dole Act enabled rushed, unsafe vaccine rollouts, and industry regulator collusion, eroding all accountability.
And trust.
And everything.
Yeah. I'll read the conclusion then. The COVID-19 pandemic response violated core principles of public health, medical freedom, and bodily autonomy, amplifying the devastating effects of SARS-CoV-2 and its modified messenger RNA, biologics, and vaccines. The overwhelming evidence of SARS-CoV-2's gain-of-function origins coupled with the catastrophic health impacts of modified messenger mRNA, COVID-19 biologics vaccines, and the unchecked expansion of next-generation messenger RNA biologics paints a chilling picture of deliberate design and systemic harm. Engineered viral features and vaccines that devastate immunological, cardiovascular, reproductive, and neurological systems have driven staggering morbidity and mortality with effects unlikely to be accidental. Coordinated efforts to obscure these truths, enabled by liability shields and legislative failures, have worsened a global health disaster. The surge in autoimmune diseases, aggressive cancers, pregnancy losses, cardiovascular fatalities, societal fragmentation, and the looming risks of advanced messenger RNA platforms demand an immediate halt to messenger RNA vaccine and biologic use, comprehensive investigations into the motives behind this unprecedented violation of public trust, and robust measures to restore safe therapeutics and ethical public health practices. Humanity deserves accountability, transparency, and a resolute commitment to preventing such engineered calamities in the future.
Yes. So a full recall of all coronavirus, mRNA vaccines, and biologics, a full moratorium on mRNA. I separately call for a complete cessation of all respiratory virus vaccinations, including the flu and coronavirus, as discussed in my previous paper, until we can demonstrate safety and efficacy and prevention of transmission, which will never be demonstrated because they don't work like that.
Mm-hmm. Right.
We at American Health Revolution are not doctors. You are a doctor.
Mm-hmm.
Karen, you're not a doctor, but I would go to you before I would go to almost any doctor.
Me too.
She's made it your business. Yeah, she's really got it going on, and you've dedicated so much of your life to understanding these issues. And again, folks, this is rooted in social justice, in a desire to make things right for a better world. This is what we're talking about. Don't be browbeat into submission. They want people to be gullible. They are counting on gullible people to subscribe to the narrative. It comes out through the media. The media and medical monetary complex is working together. We know better. We are at the American Health Revolution. We are the wide awake. We are the non-programmable, and we are the unexploitable. And we believe in wellness without compromise. That's what we stand for. We think our message is strong. We want people to join our movement because we can't do it without the grassroots support. Right, guys?
Right.
Exactly.
Right.
Okay.
It's been an absolute pleasure having you join us today, Irene.
Well, thank you.
Thank
I
you
have
so
to
much.
tell you both, thank you so much for having me. And Karen, and I know you know a lot, probably more than most doctors, but you saying that this was a relatively easy read for you because we wanted it consumable made my, 20 years. Like, I needed to hear that because that was the goal. And we're just so grateful. And thank you for taking the time to read it. It's jam-packed, I know, and it just came out, but I'm really so happy that you get the point, because if you get the point, I know you're really smart and you know all this stuff. Other people are going to get the point.
You did a great job.
We're going to put the paper up on our website, if that's okay.
That would be
.org.
Yeah.
And this discussion as well. So
thank you so much, guys. You guys are doing wonderful work.
Much. You are, as we said at the outset, one of our American heroes. Thank you.
Thank you.